Welcome to our deep dive today, and we are going to be looking into the musculoskeletal system.
Yeah,
We've got a really interesting mix of sources today, from like medical textbooks to patient guides on casts and traction.
that's right.
And by the end of this, you'll have a solid grasp on how the system works and what happens when things go wrong, and even some practical tips for dealing with common issues, especially in children.
It really is amazing to think how this system shapes our lives, from our posture to our ability to move through the world.
Yeah,
Yeah.
absolutely.
Okay.
So let's start with the basics. What are the key components that make up the musculoskeletal system?
Well, you've got the obvious ones, bones, muscles, and joints. But then there's also a whole supporting cast of tendons, ligaments, cartilage, and even these little fluid-filled sacs called bursae that act as cushions between moving parts.
Oh, right.
Yeah.
Wow. So it's interesting to think that there are 206 bones in the human body, in the adult human body. What's fascinating is that they're not all the same, are they?
No, not at all. You've got long bones like the femur that provide leverage for movement. Short bones in your wrists for intricate tasks, flat bones like your ribs that protect vital organs, and irregular bones like vertebrae with their complex roles in support and spinal cord protection.
Right?
And the way these bones grow is quite remarkable.
Yeah, I remember learning about growth plates, but honestly, the details are a bit fuzzy for me. Could you refresh my memory?
Think of it this way. Each long bone grows from its middle section called the diaphysis and the ends called epiphyses. And between these sections lies the growth plate made of cartilage. And this cartilage gradually transforms into bone as we age.
Oh, so that's how we grow taller.
Exactly.
And that explains why children's bones are more flexible and heal faster, right?
Exactly. It's like comparing a young flexible branch to a mature solid one. In children, the bones are more porous and sponge-like, which allows for quicker healing, but also makes them more susceptible to certain types of fractures.
Okay, that makes sense. Now, our sources mention a range of conditions affecting the musculoskeletal system.
Yeah.
What are some of the most common ones we should be aware of?
Well, you got the everyday sprains and fractures that most people have experienced at some point, but we also see more complex issues like joint replacements, which are becoming increasingly common, and osteoarthritis, which affects millions as they age.
Right, and I'm sure a lot of our listeners are either dealing with osteoarthritis themselves or know somebody that is. What's interesting is that our sources include these patient guides you'd get if you were in a cast retraction. It reminds me of the RIC method for sprains, rest, ice compression, and elevation. I bet most people have heard of that, but do they really understand why it works?
That's a great point. RICE isn't just some random set of instructions. It's a targeted strategy to minimize inflammation and pain. Think of it as giving your body the best possible environment to heal. By resting the injured area, you prevent further damage. Ice helps to constrict blood vessels, reducing swelling. Compression helps to stabilize the joint, and elevation helps to drain excess fluid. It's simple, but effective.
It's like a first aid toolkit everybody should have.
Yeah.
But sometimes those everyday sprains and fractures lead to needing more than just rice, right? Our sources mention a whole array of immobilization devices, casts, splints, even something called an abductor pillow.
Ah, yes, the abductor pillow.
What is that?
It's not something you'd find on your average bed.
Ugh.
This oddly shaped pillow is specifically designed to keep the hips abducted, basically spread apart after hip replacement surgery. It might seem strange, but it plays a crucial role in preventing the new hip joint from dislocating.
That makes sense. But it highlights the broader point that sometimes we need a bit more than just rest and support to heal properly. And that's where traction comes in, right? What's fascinating is that there are different types of traction, like skin traction and skeletal traction. Can you explain the difference and why you'd choose one over the other?
Absolutely. Imagine you're trying to realign a broken bone. Skin traction is like gently pulling on the limb using bandages or straps attached to the skin. It's less invasive, but also less powerful. Skeletal traction, on the other hand, is like having a direct line to the bone. It involves surgically inserting pins or wires into the bone and using those to apply a stronger, more controlled pulling force. The choice depends on the severity of the fracture and what's needed to ensure proper alignment for healing.
So it's about choosing the right level of force for the job. Now, what about those external fixators our sources mentioned? They sound a bit intimidating.
They do have a bit of a sci-fi vibe, don't they? Picture this. You've got a complex fracture, maybe with multiple bone fragments. An external fixator is like building a scaffold around the broken bone. Pins or screws are inserted into the bone above and below the fracture, and these are connected to a frame outside the body. This frame holds everything in place while the bone heals.
Oh, so it's like a high-tech support system for your bones.
Yeah.
Okay, so we've got all these methods of immobilization, but what about the day-to-day care? What are the key things to keep in mind when you're dealing with a cast or traction?
That's where things get really practical with casts. The mantra is keep it dry and don't stick anything in it. It sounds simple, but it's crucial. Moisture can damage the cast and lead to skin problems underneath. And as tempting as it might be to scratch an itch, sticking objects inside the cast can cause irritation and even infections.
I vividly remember breaking my arm as a kid and my mom being like a hawk about keeping that cast dry. Bath time was a whole production. And with traction, there's a whole other set of considerations. First and foremost, those weights have to hang freely and not touch the floor. It's not just a movie trope. It can actually disrupt the alignment of the bones and delay healing. And when it comes to skeletal traction, pin site care is paramount. You've got these pins going right through the skin and into the bone, which creates a direct pathway for infection. Meticulous cleaning and dressing are essential to prevent complications.
Right.
It's a good reminder that even seemingly simple treatments require careful attention and care. And speaking of things that can be a bit nerve-wracking, our sources mention how removing a cast can be scary, especially for children. Why is that?
Imagine being a child and hearing that buzzing cast saw coming closer and closer to your skin. It can be frightening, especially if you don't fully understand what's happening. That's why it's crucial to prepare children for this sensation, explaining that while it might sound a bit strange, it won't hurt.
All right, it's all about managing expectations. Now let's shift gears a bit and talk about a procedure that's becoming increasingly common: joint replacements. Our sources focus specifically on hip replacements, where the damaged joint is replaced with a prosthetic implant. What's intriguing is that they mention a direct anterior approach. What makes this approach different from traditional hip replacement surgery?
It's all about the incision. Traditionally, surgeons would access the hip joint from the side or back, but the direct anterior approach involves making the incision at the front of the hip. This allows them to get to the joint with less disruption to the surrounding muscles, which can potentially lead to faster recovery times and less pain. It's like taking a more streamlined route to reach the destination.
Oh, that's fascinating. And it's not just hips that get replaced. Knee replacements are also mentioned in our sources. What's the basic idea behind a knee replacement? What are some of the key things that happen after surgery to aid recovery?
Think of it like this. Your knee joint is like a finely tuned hinge, allowing for smooth bending and straightening. But when the cartilage wears down, that smooth movement becomes painful and restricted. In a knee replacement, the damaged surfaces of the joint are replaced with artificial components, restoring that smooth gliding motion.
So it's like giving your knee a new lease on life.
Yeah.
And our notes mention something called a CPM machine being used after knee replacements. What is that?
CPM stands for continuous passive motion. It's a machine that gently bends and straightens your knee joint for you, even while you're still recovering. Think of it as a personal trainer for your new knee, helping to prevent stiffness, improve circulation, and promote healing.
Oh, wow. It's amazing how all of these new approaches and technologies are helping people heal and recover better. Now, up until now, we've been talking mostly about adults, but children's musculoskeletal systems are still developing. Does that mean things work differently for them?
You're absolutely right. There are some key differences to keep in mind. As we mentioned earlier, children's bones are more porous and flexible, and they have those active growth plates. This affects everything from the types of fractures they experience to how quickly they heal. For instance, a green stick fracture, common in kids, is where the bone bends and cracks but doesn't break completely through. Kind of like snapping a young green twig.
Oh, that's a good analogy.
Yeah.
I can see how that would be more likely to happen in a child's more pliable bone. So what are some of the common types of fractures we see in children, and how are they typically treated?
Well, because children are so active, you see fractures in pretty much every bone imaginable. Forearm and wrist fractures are common from falls, as are clavicle fractures, those broken collarbones. Humerus fractures, which involve the upper arm bone, are also up there. And of course, with all that running and jumping, leg fractures are pretty frequent too, especially femur fractures in the thigh bone and tibia fractures in the shin bone. Even finger fractures are common.
Wow. Sounds like those little bones go through a lot, but you mentioned earlier that they heal faster than adult bones.
Exactly. A fracture that might take months to heal in an adult could heal in just a few weeks in a child. Treatment often involves realigning the broken bone fragments, which might be done manually in a procedure called closed reduction. And then, of course, immobilization is key. That's where casts or sometimes traction come into play. In more severe cases, if the fracture is complex or involves multiple bone fragments, surgery might be needed.
So, okay, we've talked about casts and traction in general, but are there any special considerations when it comes to caring for a child with a cast or traction?
Absolutely. Children, especially younger ones, might not be able to articulate their pain effectively. So it's crucial to be extra vigilant about pain management, using age-appropriate pain scales and medications to keep them comfortable. And just like with adults, neurovascular assessment is crucial. That means regularly checking the circulation and nerve function in the affected limb, making sure there's good blood flow and no nerve damage.
So it's about being proactive and catching any potential problems early on. Our sources mention these 5 Ps of cast care. What are those, and how do they help with that monitoring process?
The 5 Ps are like a checklist for parents and caregivers: pain, pulse, paralysis, pallor, and paleness. By checking these regularly, you're essentially doing a mini assessment of the limb's health. Is the child complaining of pain? Can you feel a pulse below the cast? Can they wiggle their fingers or toes? Is the skin pale or discolored? Are there any hot spots on the cast that might indicate pressure sores developing underneath? Any changes in these areas could signal a problem that needs immediate attention.
It's like a detective's toolkit for making sure everything is healing as it should. Now let's talk a bit more about traction in children. Our sources list all sorts of different types of traction with some pretty interesting names like Brian's traction, Russell traction, and Buck's traction. What's the deal with all these variations?
It's all about choosing the right tool for the job, so to speak. Different types of traction are used depending on the location and severity of the fracture, as well as the age of the child. For example, Bryant's traction is specifically used for young children with femur fractures. It involves suspending the child with their legs up in the air with their hips flexed at 90 degrees.
I'm trying to picture that. It sounds unique.
It is quite a sight.
Yeah.
It might seem extreme, but it's the most effective way to maintain proper alignment for certain types of fractures in young children. And then you've got variations like Russell traction, which uses a sling to support the leg, and Buck's traction, which is a simpler form of skin traction, applying a straight pull on the leg.
Okay, so there's a whole spectrum of techniques, each with its own specific purpose. But I imagine the main principles of traction care still apply.
Right? Absolutely. Keeping those weights off the floor, meticulous skin care, and especially pin site care for skeletal traction are all essential. Regardless of the type of traction being used, remember, infection is always a risk when you've got those pins going through the skin and into the bone.
Okay, so we've covered fractures in quite a bit of detail, but are there any other pediatric musculoskeletal conditions our listeners should be aware of? Our sources mention a few others, including Duchenne muscular dystrophy, slipped capital femoral epiphysis, leg calf Perthes disease, and osteosarcoma. Can you give us a brief overview of each of these?
Certainly, Duchenne muscular dystrophy is a genetic disorder that causes progressive muscle weakness and wasting. It primarily affects boys and can significantly impact their mobility over time. Slipped capital femoral epiphysis, on the other hand, is a condition where the ball at the top of the femur slips out of place from the hip socket. It often affects adolescents during growth spurts and can make even walking difficult. Leg calf Perthes disease is another hip condition, but this one involves a disruption of blood flow to the head of the femur, leading to pain and limited hip movement. And finally, osteosarcoma is a type of bone cancer that usually develops in the long bones of the arms or legs. It's the most common type of bone cancer in children and teens.
Wow, those are some pretty serious conditions. It's a good reminder that the musculoskeletal system, while incredibly resilient, can also be vulnerable to a wide range of challenges.
That's a great point, and it highlights the importance of early detection and intervention, especially in children, to give them the best possible chance of a positive outcome.
Okay, now that we've explored what happens when things go wrong, let's talk about tools that can help restore mobility and function. Our sources mention a variety of assistive devices, from crutches to canes to walkers. What are the key things to keep in mind when choosing and using these devices?
When it comes to assistive devices, it's all about finding the right fit for the individual and their needs. Crutches are great for providing support when you can't put weight on your leg or foot. The key is to make sure they're the right height. The top of the crutches should be about 2 finger widths below your armpits, and your elbows should be slightly bent when you're holding the hand grips. There are also different crutch walking gaits depending on how much weight you can bear. Your doctor or physical therapist will guide you on the best gait for your situation.
Okay, so what about canes? Are there different types of canes, and how do you know which one is right for you?
Canes come in all shapes and sizes, from single-point canes to multi-point canes for added stability. The most important thing is to choose a cane that's the right height. The top of the cane should be level with your hip joint, and the tip should be about 4 inches to the side of your foot.
Okay, here's something I find intriguing. Our sources mention that you should actually hold the cane on your unaffected side. That seems counterintuitive. Why is that the case?
It does seem a bit strange at first, doesn't it?
Yeah.
But there's a good reason for it. When you step forward with your injured leg, the cane provides support on the opposite side, creating a more stable base. And helping to prevent you from leaning or tilting to the injured side, it's all about distributing your weight and maintaining balance.
Oh, okay. That actually makes a lot of sense when you explain it that way. What about walkers? When are those a good option?
Walkers are great for people who need more support than a cane can provide, especially if they have balance issues or are at risk of falls. They come in a variety of styles, from standard walkers to rolling walkers, and even walkers with seats for taking breaks. Again, it's about choosing the walker that's most stable and comfortable for the individual to use. And then you've got these knee walkers, which are becoming increasingly popular. They look a bit like scooters and allow you to scoot around using your uninjured leg to propel yourself forward. They're a good option for people who can't put any weight on their lower leg or ankle, but still want to be mobile.
So there's a whole range of assisted devices out there to help people regain their mobility and independence. It's amazing to see how technology and design are being used to address these challenges. But before we get too ahead of ourselves, let's wrap up this part of our deep dive and take a closer look at the world of physical therapy and rehabilitation in part two.
That's a great idea. Rehabilitation is where we really see the intersection of science, technology, and human resilience. It's about empowering individuals to reclaim their lives and reach their full potential.
I love that perspective. We'll delve into all of that in part two, so be sure to join us as we continue our exploration of the fascinating world of the musculoskeletal system. Welcome back. In part one, we explored the incredible complexity of the musculoskeletal system, from the types of bones and how they grow to the challenges of fractures and joint replacements. Now let's dive into a realm where recovery and resilience take center stage, the world of physical therapy and rehabilitation.
I'm glad we're focusing on this aspect because it's often where the real transformation happens. It's not just about fixing the physical problem, it's about restoring function, mobility, and ultimately quality of life.
Absolutely. And so let's start with the basics. What exactly is physical therapy, and what role does it play in addressing musculoskeletal issues?
Well, physical therapy, or PT as it's often called, is all about movement. It's a healthcare profession that focuses on evaluating, diagnosing, and treating movement disorders and functional limitations. Think of physical therapists as movement experts who use a variety of techniques to help people improve their range of motion strength, flexibility, balance, and coordination.
So they're like the mechanics of the human movement system,
Exactly.
figuring out what's not working right and then finding ways to get things moving smoothly again.
Yeah.
So what are some of the conditions that physical therapists commonly treat?
Oh, they work with a wide range of individuals, from athletes recovering from sports injuries to seniors managing chronic pain. You'll find them helping people regain mobility after surgery, working with those who have neurological conditions affecting their movement, and even supporting children with developmental delays.
It sounds like they have a pretty diverse toolbox of techniques to address all those different needs. Our sources mention hands-on techniques, therapeutic exercises, and assistive devices. Can you break down each of these categories and give us some specific examples?
Sure, let's start with hands-on techniques. One of the most common is manual therapy, where the therapist uses their hands to mobilize joints, stretch muscles, and release tension in soft tissues. It's like a targeted massage for your musculoskeletal system. They might also use techniques like myofascial release, which focuses on releasing tension in the fascia, the connective tissue that surrounds muscles and organs.
So it's a very hands-on, literal approach
Yes.
to addressing those aches, pains, and restrictions. And what about those therapeutic exercises you mentioned? What are some examples of those, and how are they tailored to the individual's needs?
Therapeutic exercises are all about strengthening, stretching, and retraining those muscles and joints to function optimally. The exercises themselves can range from simple bodyweight movements to more complex exercises using resistance bands, weights, or specialized equipment. But what makes them therapeutic is that they're specifically designed to address the individual's limitations and help them achieve their goals.
So it's not just a generic workout routine. It's a personalized plan based on your specific needs and goals. And what about the role of assistive devices in physical therapy? We talked about crutches, canes, and walkers in the last part. How do those fit into the bigger picture of rehabilitation?
Well, assistive devices are like temporary supports, helping people regain their independence and mobility while they're recovering. Physical therapists are skilled at assessing which device is most appropriate for the individual's needs, and teaching them how to use it safely and effectively. It's about bridging that gap between limitation and function.
Okay, and it's not just about handing somebody a pair of crutches and saying good luck. It's about providing instruction, guidance, and support throughout the process. Now, our sources highlight that rehabilitation is particularly crucial for children with musculoskeletal conditions. Why is that?
Well, children's bodies are still growing and developing, so addressing movement issues early on can have a huge impact on their long-term outcomes. Think of it this way. If a child develops an abnormal movement pattern due to an injury or a condition, that pattern can become ingrained as they grow, leading to further problems down the line. But if we intervene early with targeted therapies and exercises, we can help them develop more optimal movement patterns and prevent those long-term complications.
So it's about setting them up for success both in the present and in the future. Now, I'm curious to hear some specific examples of how physical therapy can benefit people with common musculoskeletal conditions. What are some of the key ways it can help those recovering from fractures, joint replacements, or dealing with chronic conditions like osteoarthritis?
Let's take the example of someone recovering from a fracture. Physical therapy isn't just about waiting for the bone to heal. It's about actively working to restore function in that limb. They might focus on range of motion exercises to prevent stiffness in the affected joint strengthening exercises to build up the surrounding muscles, and even gait training to help them walk normally again.
So it's a holistic approach that addresses both the immediate needs and the long-term goal of regaining full function. And what about someone who's had a joint replacement, like a hip or knee replacement? How does physical therapy play a role in their recovery?
Well, joint replacement surgery is a major life event. It's not just about swapping out a damaged joint for a new one. It's about retraining your body to move efficiently and painlessly with that new joint. Physical therapy plays a crucial role in this process. They'll guide you through exercises to improve your range of motion, strengthen the muscles surrounding the joint, and teach you how to move safely and confidently with your new hardware.
It's more like learning to walk again, but this time with a bionic upgrade. And what about for those dealing with chronic conditions like osteoarthritis? Can physical therapy offer any relief or support?
Absolutely. While there's no cure for osteoarthritis, physical therapy can be incredibly helpful in managing the symptoms and maintaining function. They might focus on exercises to strengthen the muscles surrounding the affected joint, which can help to stabilize the joint and reduce pain. They might also work on improving flexibility and range of motion, which can ease stiffness and make everyday activities easier. And they can teach you strategies for protecting your joints and preventing further damage.
So it's about finding ways to live well with the condition, to manage the pain, and to keep moving as best as possible. Now, our sources mentioned something called aquatic therapy being used in some cases. What's the advantage of doing therapy in the water?
Aquatic therapy or hydrotherapy is a fantastic option for people who find land-based exercise too painful or challenging. The buoyancy of the water supports the body, reducing stress on the joints, while the water's resistance provides a gentle yet effective form of strength training. It's particularly beneficial for those with arthritis, back pain, and other conditions where weight bearing can be an issue.
It's like getting a workout without feeling the weight of gravity holding you back. Now, let's say somebody is listening to this and thinking, okay, physical therapy sounds like something I could benefit from. How do they actually get started? Do they need a referral? And what can they expect at their first appointment?
Well, in most cases, you'll need a referral from your doctor or other healthcare provider. They'll assess your condition and determine if physical therapy is appropriate for you. They might also recommend a specific type of therapy, or even a particular therapist who specializes in your area of need. Your first appointment will typically be an evaluation. The therapist will take a detailed history, ask about your symptoms, and do a physical assessment to evaluate your range of motion strength and overall function.
Oh, so it's a comprehensive assessment to get a baseline of where you're at and what your needs are. And then based on that evaluation, they develop a personalized treatment plan, right?
Exactly. The plan outlines your goals and the interventions they'll use to help you achieve them. This might include hands-on therapy, specific exercises, and maybe even assistive devices. It's a collaborative process with the therapist providing guidance and expertise, and the patient actively participating in their recovery.
And how long does physical therapy typically last? Is there a set time frame, or does it vary depending on the individual and their condition?
There's no one-size-fits-all answer. It could be a few weeks for a minor injury, or months or even years for a chronic condition or a more complex recovery. The key is to work closely with your therapist, follow their guidance, and be patient with the process.
Okay, and are there any risks or side effects associated with physical therapy that people should be aware of?
Generally speaking, physical therapy is very safe when done correctly. You might experience some muscle soreness or fatigue after a session, which is perfectly normal. But it's important to communicate openly with your therapist about any pain or discomfort you experience. They'll adjust the treatment plan as needed to ensure your safety and comfort.
Okay, so it's a two-way street. The therapist provides the expertise, and the patient provides feedback on how their body is responding. Our sources emphasize the importance of patient motivation in physical therapy. Why is that so crucial?
Think of physical therapy as a partnership. The therapist provides the roadmap, but the patient has to do the driving. It requires active participation and a willingness to put in the effort. If you're not motivated, you're less likely to stick to the program and see the results you're hoping for. But when you're engaged and committed, physical therapy can be truly transformative.
It's a reminder that healing is an active process, not something that just happens to you. You have to be an active participant in your own recovery. Now, before we move on to the final part of our deep dive, is there anything else our listeners should know about physical therapy and its role in musculoskeletal care?
One key point is that physical therapy isn't just for people with injuries or chronic conditions. It can also be a valuable tool for preventing musculoskeletal problems in the first place.
That's interesting. So it's not just about fixing what's broken, it's about building strength and resilience to prevent those problems from happening in the first place. How does that preventive aspect work?
Well, physical therapists are trained to assess your movement patterns, identify areas of weakness or imbalance, and teach you exercises and strategies to improve your posture, flexibility, and strength. They can help you develop better body mechanics, which can reduce your risk of injuries in the long run.
So it's like a proactive approach to musculoskeletal health, kind of like going to the dentist for regular cleanings to prevent cavities. Now, as we wrap up this part of our deep dive, I want to touch on a point you made earlier about the interconnectedness of the body. You mentioned that the musculoskeletal system doesn't operate in isolation, but rather in concert with other systems. Can you elaborate on that and explain why that's important to keep in mind?
Absolutely. It's easy to think of the musculoskeletal system as separate from, say, the circulatory or nervous system, but in reality, they're all intricately linked. Your muscles need oxygen from your respiratory system to function properly. Your bones rely on nutrients from your digestive system to stay strong. And your nervous system is the conductor orchestrating all those movements. Physical therapy often takes this holistic view, recognizing that addressing the musculoskeletal system might also involve incorporating breathing exercises to improve respiratory function, relaxation techniques to manage stress, or even dietary recommendations to support overall health.
That's a fascinating perspective. It's a reminder that our bodies are complex, integrated systems, and that true healing often involves addressing multiple aspects of our well-being.
Hello.
Well, we've covered a lot of ground in this part of our deep dive. We've explored the principles of physical therapy, the diverse techniques involved, its role in rehabilitation, and its importance in both treatment and prevention. In the final part, we'll zoom out a bit and explore some broader implications of what we've learned about the musculoskeletal system and its impact on our lives. Welcome back to the final part of our musculoskeletal deep dive. We've covered so much, from the anatomy of bones and muscles to the challenges of injuries and treatments and the power of rehab.
Yeah, it's amazing how vital this system is to our everyday lives.
Yeah, absolutely.
And in this final part, I'm excited to shift our focus to the bigger picture. How do factors like aging and even our daily habits impact the musculoskeletal system, and most importantly, what we can do to protect it?
Okay, let's start with aging. It's inevitable. We all know our bodies change as we get older. But what's actually happening beneath the surface, specifically within our musculoskeletal system?
Well, unfortunately, there are several changes that occur naturally as we age. Our bones tend to lose density, making them more susceptible to fractures. The cartilage that cushions our joints wears down, leading to stiffness and pain, and our muscles gradually lose mass and strength, which can increase the risk of falls and injuries.
So it's like a trifecta of challenges: weaker bones, stiffer joints, and less muscle power. It paints a bit of a bleak picture, doesn't it?
Yeah.
But I'm hoping there's a silver lining here. Our sources mentioned ways to mitigate these age-related changes. What are some of the key strategies for maintaining musculoskeletal health as we get older?
Well, the good news is that we're not powerless against these changes. There's a lot we can do to slow down the process and stay active and mobile well into our later years. And it all starts with exercise.
Okay, tell me more. What types of exercise are most beneficial for aging bones and muscles?
Think of it as a three-pronged approach: weight-bearing exercises, strength training, and flexibility exercises. Weight-bearing exercises like brisk walking, jogging, or even dancing help to stimulate bone growth and maintain bone density. It's like sending a signal to your bones saying, hey, we need you to stay strong. Strength training using weights or resistance bands is crucial for preserving muscle mass and strength, and flexibility exercises like yoga or Pilates help to maintain range of motion in your joints and prevent stiffness.
So it's about finding a balance between strengthening, stretching, and impact. And it's never too late to start right.
Exactly. It's a common misconception that exercise is only beneficial when you're young. The truth is that even older adults can see significant improvements in their bone density and muscle strength with regular exercise. It's about making movement a part of your life, no matter your age.
That's really encouraging. And what about nutrition? Does that play a role in musculoskeletal health as we age?
Absolutely, just like any other system in the body. The musculoskeletal system needs the right nutrients to function optimally. Calcium and vitamin D are particularly important for strong bones. You can get calcium from dairy products, leafy green vegetables, and fortified foods. And vitamin D is produced by your skin when it's exposed to sunlight.
Right. So a balanced diet and a bit of sunshine can go a long way in supporting our bones. Now let's shift gears a bit and talk about something that might seem unrelated at first, but actually has a huge impact on our musculoskeletal health ergonomics.
That's a great point. People often underestimate the role of ergonomics in preventing musculoskeletal problems. But think about it, we spend hours each day sitting at our desks, hunched over our computers, or engaging in repetitive tasks that can put strain on our muscles, joints, and tendons. Over time, this can lead to pain fatigue and even serious injuries like carpal tunnel syndrome or back pain.
I can definitely relate to that. I've had my share of neck and shoulder aches from sitting at my desk for too long. So how can we apply the principles of ergonomics to protect our musculoskeletal system in our daily lives?
It starts with awareness. Pay attention to your posture. Are you slouching or hunching over? Make adjustments to your workspace. Is your chair providing adequate back support? Are your keyboard and mouse positioned in a way that allows you to keep your wrists straight and relaxed? Take breaks to stretch and move around. Get up and walk around every hour, even if it's just for a few minutes. These small changes can make a big difference in preventing long-term problems.
It's like the saying, an ounce of prevention is worth a pound of cure.
Yeah.
By incorporating ergonomic principles into our daily routines, we can proactively protect our bodies from strain and injury. Well, it feels like we've come full circle in our exploration of the musculoskeletal system. We journeyed from the basic building blocks of bones and muscles to the complexities of injuries, treatments, and the power of rehabilitation. And now we've arrived at this broader understanding of how our lifestyle choices, from exercise to nutrition to ergonomics, can profoundly impact the health and longevity of this incredible system.
As we wrap up this deep dive, I want to leave you with a final thought. We often take our musculoskeletal system for granted until something goes wrong. We don't realize how much we rely on it until we experience pain, stiffness, or limitation. But it's truly the foundation of our physical freedom, allowing us to move through the world, interact with our environment, and experience life to the fullest.
That's beautifully put. It's a powerful reminder to cherish our ability to move and to make choices that support the health of this incredible system that makes it all possible. Thank you for joining us on this journey of discovery into the fascinating world of the musculoskeletal system. We hope you've gained a deeper appreciation for this incredible system that keeps us moving and empowers us to live our lives to the fullest.